All right, let's dive into a topic that's a massive deal, not just for global health, but for international relations. We're talking about America's decision to leave the World Health Organization. Now, if you're preparing for the civil services, this isn't just another headline. Nope, this is a classic GS2 case study, a perfect storm of diplomacy, health security, and geopolitics that could easily be a 15-marker on your mains paper.
I mean, just let that sink in for a moment. Could the next big one, the next global pandemic, start completely off the radar because the system designed to detect it is breaking down? For India, this isn't some far-off academic debate. It's a real, direct threat. Stick with me, and by the end of this, you'll not only understand this great decoupling, but you'll know exactly how to analyze it for your exam.
So here's how we're going to tackle this. First, we'll explain the event itself, get the facts straight. Then we'll dig into the really juicy part, why America left. After that, we'll look at the global fallout, and then zoom right in on what this all means for India, the risks and the opportunities. And we'll wrap it all up with a clear path forward that doubles as a perfect answer structure for your exam. Let's get into it. Okay, part one, the event explained. We need to lay the foundation here. Getting the basic what, when, and how is crucial context for both your prelims facts and your mains analysis. This timeline really tells a story, doesn't it? The U.S. was a founding member way back in 1948, but look at this recent whiplash. A withdrawal notice in 2020, reversed in 2021, only to be reinitiated in 2025 for a final exit in 2026. This back and forth itself is a huge point. It speaks volumes about the unpredictability of U.S. foreign policy right now.
And that brings us to a really important term you should use in your answers: institutional decoupling. Now, this is so much more than just cutting a check. It means pulling the plug completely. It's a total severance of financial, technical, and even the intellectual ties. We're talking U.S. experts getting recalled, data sharing stopping, the whole shebang. It's a massive policy shift away from working with many nations to just doing one-on-one deals.
Which leads us right to part two, the absolute core of this topic for mains. Why? Why did America actually leave? If you can nail the reasons behind this, you're halfway to a brilliant answer.
So it really boils down to three main arguments from the U.S. side. First, the big one: accusations that the WHO was too China-centric, especially during the early days of COVID-19. Second, this feeling of a disproportionate financial burden, basically that the U.S. was paying way more than its fair share. And third, and this is crucial, a deep ideological shift to an America-first foreign policy, one that sees these big global bodies as a threat to national sovereignty.
Wow, okay, this slide right here, this is what puts that money argument into sharp focus. Just look at the numbers for 2022-23. The U.S. put in over $1 billion in voluntary funds. $1 billion. Now look at China, around $41 million. That huge gap was Exhibit A for the U.S. administration. And hey, notice who else is on that list. The Gates Foundation, a private charity. That tells you a lot about how global health is funded these days.
So, the U.S. is out. The decision is made. Now what? What happens to the world? Let's move to part three and really analyze the global fallout. This is where we connect the dots from cause to effect.
Now, to really grasp the systemic impact, I want you to use this memory anchor. Picture global health as a giant Jenga tower. The U.S. wasn't just some random block you could pull out from the middle. No, it was a foundational one at the very bottom, holding things up with money and expertise. When you yank that piece out, you don't just get a hole. The whole tower, from polio eradication to pandemic surveillance, starts to wobble. It's a perfect way to think about systemic risk.
And let's put some numbers to that wobble. The U.S. chunk was about 20% of the entire WHO budget. But here's the real kicker, the detail you have to remember. It's not just the amount, it's the type of money. The U.S. was the biggest donor of voluntary contributions. That's the flexible, fast cash that WHO uses to jump on emergencies. Losing that cripples its ability to respond quickly to a new outbreak.
But money is one thing. What might be even worse is this: the brain drain. The U.S. pulled hundreds of its top experts from the CDC. These are literally the world's best epidemiologists, the special forces of public health. These are the people on the ground verifying outbreak data, managing vaccine logistics, and forming the backbone of programs like polio eradication. When they're gone, the WHO's operational capacity takes a massive hit.
Okay, listen up, because this is your first exam trap.
It is so easy to just talk about the money, but the deeper, more insightful point, the one that will make your answer stand out, is arguing that the real crisis is this irreplaceable loss of technical expertise. That's the brain drain. That's your value addition point right there.
All right, quick recall checkpoint. We just talked about two types of funding the WHO lost. What were they? Assessed and voluntary. And which one deals the biggest immediate blow to its ability to fight emergencies? You got it, it's the flexible voluntary funds. Nailing that detail shows you really understand the mechanics of this.
Now, all this global chaos, it creates a really interesting and kind of tricky situation for India. So let's dive into part 4 and break down India's strategic calculus, the clear risks versus the potential opportunities.
You've really got to look at this as a double-edged sword for India. On one side, the vulnerabilities are serious. Key programs like our National Polio Surveillance Project, which rely on WHO support, are suddenly at risk. Same for the technical help we get for our National TB program. But, on the other side of the coin, a huge vacuum opens up. This is a chance for India to step up and lead the global south, to double down on our role as the pharmacy of the world and the push for mainstreaming traditional medicine on a global stage.
All right, now it's your turn. Let's do a little role-playing. This is exactly the kind of thing they'll throw at you in the interview. So, you're the foreign secretary. China comes along and offers to fill the WHO's funding gap, but there are strings attached that all favor its own Health Silk Road project. What do you tell the Prime Minister? You'd break it down. Pro, it solves the money problem fast. But the cons, the cons are big. 1, it creates a strategic dependency on China. 2, their conditions could hurt our own pharma industry. And 3, it basically kills India's own ambition to be a global health leader. See? Structured, balanced thinking is key. Okay, let's tie all these threads together in our final section, part 5. We're going to talk about navigating this new reality, and most importantly, how to structure this entire analysis into a winning exam answer. But first, just take a second. Let's have a quick micro-pause for reflection. The whole America First argument is based on the idea of national sovereignty. But think about it. In a world where a virus can cross any border in hours, is absolute national sovereignty even realistic anymore? That's a deep, philosophical question you could explore beautifully in your essay paper. So where do we go from here? What's the constructive path forward? Well, there are 3 big ideas on the table. First, the WHO itself has to diversify its funding, maybe through what they're calling an investment round. So it's never this dependent on one country again. Second, the world needs to build up regional bodies, like the Africa CDC, to create a more resilient, decentralized network. And third, India has to proactively step up, to shift its identity from being a recipient of health aid to a provider of global health security. And here's the second big exam trap to watch out for. Don't fall into the simplistic trap of framing this as just US versus China. That's the surface-level take. A much more sophisticated answer argues that this is a symptom of a much bigger trend, a shift to a more fragmented, minilateral world order. Seeing that bigger picture is what separates a good answer from a great one. So this is it. This is your blueprint for a killer mains answer on this topic. Start your intro by contextualizing the US exit as a major event. In the body, you hit all the key points we discussed: the why, the global impact, and the specific India angle. Then, for your way forward, you offer those constructive, balanced solutions. And for a truly top-tier conclusion, you link this specific event to that broader theme, the fracturing of the entire post-war global order. And I'll leave you with this final, provocative thought to chew on. Is this great decoupling the beginning of a global health catastrophe? Or could this very crisis be the shock to the system that forces regional powers like India to finally step up and build something better, something more resilient and decentralized for the future? Honestly, the jury's still out. Okay, that's a wrap on this deep dive. Now, to really lock this all in, we've put together some high-yield notes and a really helpful quick revision mind map that covers everything we just went over. The link is right there in the description below. Make sure you grab them. They'll be a huge help. Happy learning!